Please could you start by just introducing yourself?
Yeah, so I'm Mark Allan. I'm the General Manager of Bupa Dental Care here in the UK and Republic of Ireland.
And when you talk about holistic health, what do you mean by that?
Yeah, there's a lot going on with a topic like holistic health. What we're trying to do at Bupa Dental Care is create, a different kind of dentistry business. There's some things that are quite unique and different about us. We're a market-leading dentistry business, but we're also a market-leading dental insurer and health insurer. That's unique. We're a provident association, so all of our profits get reinvested back into our patients and our people experience. And critically, we're a healthcare company with huge expertise across the Bupa Group in all manner of healthcare topics. So when we talk about holistic health, we're really trying to work out how do we take all of that healthcare expertise that we have here at Bupa and use it for the benefit, certainly of our patients, but perhaps in what we're talking about today, really for the purpose of how we look after our people really well, both our employed and our self-employed people. And there's probably a couple of ways that we're focused on doing that. One is the benefits that we give people and the way we look after people individually. So the tools they have access to look after themselves and keep them healthy, keep them in a good mindset. But also the tools and the skills that we give practice managers to make sure that they can really do a great job of looking after their teams really effectively. And again, that's both our employed colleagues, but also our self-employed clinicians.
So could you talk us through some of the initiatives that you've introduced to highlight those values that you're talking about?
Yeah, there's a lot we've done, especially over the last 18 months or so to really accelerate this journey. But the things we've done probably fall into a couple of categories. The first one is, as I said, the benefits that we give our own people and the things they have individually access to. So, for example, we've put a major emphasis on women's health. We've given access to all of our employees a free menopause plan. We've given access to our employees a free period plan. That's enabling our female employees to really ensure they're seeking out the support where they need it to look after themselves really well, which obviously has benefits for them personally, but also keeps people in the workplace, keeps the practice working effectively. We've given paid time off for IVF, paid time off for baby loss, and there's a whole range of dedicated wellbeing support that sits around that any of our employees can access. We also have subsidised private medical insurance for our self-employed associates and obviously wider support there. The other thing that's just as important though is the support we give and the guidance and tools we give to our practice managers. As I said, the practice manager plays a key role really in the wellbeing and the health of their employees. We give our people access to something called Jack. That stands for Just Ask a Question. We have a Jack platform for our employees, and we also have a Jack at Work platform which gives leader support. And that gives our people access to over 80 mental health and wellbeing topics and conversations that are going on from people with learned experience of suffering from conditions such as depression, addiction, stress, bereavement, suicide, fertility issues. And it's a really powerful way of providing people with the support they need at times of real difficulty in their lives. Then complementing that, we have something called the Bupa Academy, and that is a whole range of tools and resources available to leaders to help them have conversations around things like neurodiversity, mental health conditions, prostate cancer, you name it. Things that are going on in people's lives where we are equipping our practice managers to have the bravery and the comfort to go and open those conversations. And our experience is sometimes just knowing that someone's willing to have that conversation and look out for you is a massive help compared to sitting there suffering in silence, feeling like you can't talk about your condition. So it's really making a difference.
So what impact would you say that those initiatives are having on your people?
Yeah, so our perception is there's a really good momentum building in the way people feel about Bupa Dental Care when they work here. The best evidence we've got is our half-yearly employee survey that we run, which actually we've just done 2 weeks ago. But it's really great to see on the back of all the efforts we've been putting in, and particularly this holistic health approach, we've just achieved an externally accredited position of world-class engagement for both employed and self-employed colleagues, and that's against the independent providers global database of companies. I can't promise you that that's the direct link, but there's no doubt that that everything we've been doing here and using this approach of really looking after people well is having a massive impact there.
Amazing. So looking to the future, are there any exciting plans that you would be able to share with us?
We've got a huge amount of plans coming to continue to develop that compassionate approach and make sure our people feel looked after. We've put a lot of emphasis on nurses over the last few months, including the appointment of a head of nursing in Bupa Dental Care, whose job it is to make sure that as an executive team we can see through the eyes of what it's like to be a nurse in Bupa Dental Care. And the combination of roles like that with all the data that we see out of that employee engagement score, that gives us loads of clues and loads of things that we can focus on to both fix things, but also opportunities to really stand out and be, as I said at the start, really a very different kind of employer who's really passionate about this area. So I'd say watch this space. I don't want to give away all of our plans, but hopefully you can see this is something we're incredibly committed to. And if you're an employer today, there is no getting away from the fact that you have a big responsibility for your employees and self-employed clinicians' welfare and their health. And it makes great business sense as well to be able to keep people engaged in the workplace, wanting to stay with you, and people who don't work for you seeing what's going on and wanting to come and join you. So plenty more up our sleeve.
That's great to hear. Well, thank you so much again for joining me today.
Great. No, it's been brilliant to talk to you.